Our social welfare program presentation was conducted by Faith Wolf, Lillian Driscoll, and myself, Haley Bright. We will be presenting the Special Supplemental Nutrition Program for Women, Infants, and Children, or better known as WIC. WIC supports families in need and the ways the program can continue to grow and improve. For this slide, I'll be going over the introduction and program overview. WIC is a federal program that provides food, nutrition, support, and access to healthcare for low-income women and children. The overall goal is to improve the overall health and nutrition for mothers and kids who might otherwise face food insecurities. WIC doesn't just give out food, it is more to that. It's more community involved in helping the individual and their families. And it connects those families to healthcare and teaches them healthy eating habits and coaches them on nutrition. So it takes both the side of poverty and the healthy well-being of the individual and their family. Here we're taking a look at the target population. The target population includes pregnant women, new mothers, infants, and children under 5 who are considered at nutritional risk. Individuals that receive assistance from WIC receive nutritional food, nutrition education, and referrals to healthcare and other services. So again, it's not about supplying food, but it's also creating a space for nutritional education as well. And basically, the program tries to support families during those early years and the critical and formative times. And it focuses on the well-being and overall growth and development of the child and the family. Here's a breakdown of the target population. In 2024, WIC served around 6.7 million people every month. That's almost half of all infants in the United States. The federal government spent about $7.2 billion on the program that year. The chart on this slide shows participants over time, and you can see how WIC has continued to reach millions of families and so many families that are in need of assistance over the past 50 years. And it's honestly one of the most impactful nutritional programs that we have available to women and children. Here we're taking a look over the penetration rate, or how many people that the program is reaching. Even though WIC serves millions of people, it only reaches about half of those people who qualify, which is a little bit over 50%. When we break it down, women make up 23% of the participants, infants that are around 24%, and children who are 53%, which is over half. So children are the largest group served, which shows how essential this program is to the development and healthy well-being of children. When it comes to overviewing the analysis and research, there's still a lot of barriers keeping families from accessing and using WIC. Some include limited access to program information, a lack of awareness in certain communities, and not enough research or influence and enhancements to the individuals. There's also a big gap when kids age out of the program around age 5, and their nutrition often declines, which shows a clear need for continued support with this program and how the age should expand beyond 5. These challenges point to areas where the program could really grow and enhance. Our first recommendation is to expand WIC's eligibility to cover children up to the age of 17 instead of just stopping at ages 5. So kind of picking up from where the last slide left off, this would help us close that nutritional gap as kids grow and they're still developing, because they don't stop developing at age 5. We also suggest adding more nutritional education programs so that mothers and children can better understand healthy eating and apply it long term for growth. And studies show that when women receive nutritional education, the whole family can benefit, not just mom or the child. It expands onto siblings and the whole family. Our second recommendation is to raise the income eligibility by around $10,000 so more families can qualify. Right now, it's around $29,000, which isn't a lot of money. And if we increase that amount, more families could be eligible for assistance. Many working mothers fall just above the income, but still struggle to afford healthy food. We also think that WIC should expand and include more organic options, offering more natural and less processed foods to help better healthy outcomes for the family. Our third and final recommendation focuses on giving women more choice when it comes to feeding their infant. Some women may not be able to breastfeed or not want to breastfeed, and that's okay because it's their choice. The program should make sure formula is equally accessible and covered for mothers, and overall, WIC should ensure that everyone, regardless of their situation, gets the nutritional support they need. On this slide, we have an overview of the cost and feasibility. WIC costs about $7.2 billion annually, which sounds high and it's a little expensive, but it actually is a solid investment considering the health benefits that women and children receive from it. Expanding eligibility could be manageable if done smartly and done in a correct way, like using online tools such as pre-filled grocery carts or having virtual nutrition options and sessions. Training healthcare and social service staff more efficiently could also help make these expansions more realistic and more cost effective. In conclusion, WIC has made a huge impact over the years by reducing food insecurity and improving the health of women and children. It's more than just a food program, it's a support system that helps families build healthier habits and access information and resources. With a few updates, like expanding eligibility and improving accessibility, WIC could reach even more people and close the gap that still continues to exist. Overall, WIC can help create stronger families and healthier communities, which is really what social policy is all about. That wraps up our presentation and overview of WIC. Thank you for watching.